What is Afib and how does it relate to heart failure? My name is Danielle and I'm a registered nurse. I have worked with many patients with heart conditions, including those with heart failure. I take complex medical conditions and I break them down into human words to empower you to take charge of your own health. This video is structured a little differently from my previous videos. I'll start with a simple overview, and if you're a just give me the basics kind of person, then you can turn the video off after that. But if you're a I like the details kind of person, then the remainder of the video will break down what's actually happening in the heart, how Afib leads to heart failure, and what we do about it. So, simple breakdown. Afib is short for atrial fibrillation. It's one of the most common abnormal heart rhythms, also called an arrhythmia. Basically, instead of the heart beating in a nice regular pattern, the electrical signals become chaotic and irregular. Some people don't even realize they're in Afib. Others feel palpitations, fatigue, dizziness, shortness of breath, or just generally awful. Sometimes we don't know what triggers Afib, but sometimes we can point the cause to some kind of stress on the body, like an illness, drugs, or alcohol. Afib makes the heart beat irregularly and sometimes too fast. Over time, that can make it harder for the heart to properly fill with blood and properly pump the blood out to the rest of the body. When that happens, blood and fluid can start backing up into the lungs and tissues, causing the symptoms of heart failure like shortness of breath and swelling. Treatment usually focuses on four main goals: treating whatever may have triggered the Afib, slowing down the heart rate, preventing stroke with a blood thinner, and trying to restore a normal rhythm if appropriate. Sometimes, once the heart is back under control, the heart failure symptoms improve significantly. Other times, if the heart has been under strain for too long, some of the damage may be permanent and heart failure becomes a chronic condition to manage. So that's the short version. If you're one of those just give me the basics kind of people and you're satisfied with that explanation, you can absolutely stop here. Don't forget to like and subscribe on your way out. But if you want to understand why Afib causes heart failure, what Afib with the RVR means, or what cardioversions and ablations actually do, keep watching. Normally, the electrical signal in the heart follows one organized pathway that tells the atria and then the ventricles exactly when to contract. These ventricular contractions are your heartbeat. And this is what that looks like on an EKG. Even if you don't know how to read EKGs, you can still see that normal sinus rhythm has a regular, predictable pattern. But in Afib, the electrical activity becomes disorganized. Those chaotic signals cause the atria to kind of quiver or fibrillate instead of squeezing effectively. And because the ventricles are getting bombarded with the irregular signals too, the heartbeat becomes irregular as well. And this is what Afib looks like on an EKG. The beats are irregularly spaced and the baseline looks chaotic and wavy. You may also hear about atrial flutter or Aflutter. Aflutter is very similar to Afib, except the electrical activity is more organized, so it creates this classic sawtooth pattern on the EKG. But the end result is basically the same. The heart beats too fast and inefficiently, so we generally treat them very similarly. And if you hear Afib or Aflutter with RVR, that stands for a rapid ventricular response. Simplified, it just means the heart is beating too fast on top of beating irregularly. This can quickly wear the heart down. So how does this become a heart failure problem? There are two really big issues. First, the heart isn't squeezing efficiently. The ventricles, especially the left ventricle, needs a nice, strong, coordinated contraction to push blood out to the body. But if the heart is beating irregularly and too quickly for long periods of time, the heart muscle starts getting worn out and weaker. This means less blood is getting pumped out to your organs and tissues. This is called decreased cardiac output. And remember, your blood carries oxygen everywhere your body needs it. So low cardiac output means your organs and tissues may not be getting enough oxygen to function properly. The second problem is filling. Your heart has to relax in between beats in order to fill with blood. But if the heart is beating too fast and irregularly, sometimes there isn't enough time for proper filling before the next contraction happens. So now you have two problems happening at the same time. The heart isn't filling well, and it isn't pumping well. That creates kind of a bottleneck effect. Blood starts backing up behind the heart, and fluid from the blood vessels starts leaking into places it shouldn't be, especially the lungs and the tissues. That's what causes the symptoms like shortness of breath, swelling in the legs, fluid retention, fatigue, and difficulty laying flat. And this gets even worse in Afib with RVR because the faster the heart beats, the less time it has to fill properly. So what do we do about it? If you're found to be in Afib with RVR, you'll often be told to go to the ER because the heart may need pretty aggressive treatment and monitoring to get it back under control. One of the first things the doctors will look for is whether something triggered the Afib in the first place. Sometimes Afib happens spontaneously, but sometimes there's a clear stressor on the body, like infection, alcohol use, thyroid problems, surgery, severe illness, stimulant drugs, or even uncontrolled heart disease. So if possible, we try to treat the underlying trigger as well. From there, treatment usually focuses on 3 major goals. Step 1, slow the heart rate down. A heart that beats too fast for too long can weaken over time, so medications are often used to slow and stabilize the heart rhythm. This is usually done with medications like beta blockers or calcium channel blockers. In more stubborn cases, stronger antiarrhythmic medications may be used, but those come with higher risks and side effects. I'll do another video focusing on Afib and heart failure meds because that's a lot of information. Step 2, prevent stroke. This is actually one of the biggest concerns with Afib. Because the atria aren't squeezing effectively, blood can pool inside the heart and form clots. If one of those clots travels to the brain, it can cause a stroke. That's why most patients with Afib are started on blood thinners like Eliquis or Xarelto. Step 3 is typically try to restore normal rhythm if appropriate. And sometimes the medications alone will actually convert the heart back into sinus rhythm. If not, your doctor may recommend procedures like a cardioversion or an ablation. A cardioversion delivers a controlled electrical shock to the heart to basically try to reset the electrical system back into a normal rhythm. An ablation is more invasive. A cardiologist specializing in electrophysiology, also called an EP doctor, identifies the area in the atrium causing the abnormal electrical signals and creates scar tissue there to block those signals from spreading. Unfortunately, neither procedure guarantees that Afib won't come back. Some people need repeat procedures or long-term medications to keep their rhythm controlled. And in some severe or resistant cases, a pacemaker may eventually be recommended. But it's worth mentioning that not everyone in Afib actually needs to be converted back into sinus rhythm. In some patients, especially if they're older, their symptoms are minimal and not significantly affecting quality of life, and their heart rate is already well controlled with meds, doctors may decide it's safer and more appropriate to simply maintain the heart rate and keep them on a blood thinner to reduce stroke risk. In other words, some people will continue living in Afib long-term and do quite well as long as their rhythm is being managed appropriately. So, just to recap, Afib is an abnormal, irregular heart rhythm that can make the heart beat too fast and inefficiently. Over time, that can weaken the heart, decrease cardiac output, and cause blood and fluid to back up into the lungs and tissues, leading to heart failure symptoms. Treatment focuses on slowing the heart rate, preventing stroke, treating underlying triggers, and restoring normal rhythm when possible. And the earlier Afib is recognized and treated, the better chance we have at preventing long-term damage to the heart. Hopefully this helped break things down and make it feel a little less overwhelming. If you want a deeper breakdown on Afib medications, cardioversions, ablations, or heart failure itself, let me know in the comments because there's definitely more we can dive into. Don't forget to hit that like button if this video did help you, and make sure you subscribe to my channel to be notified when I release my next video.